Who can become a member? Getting people involved is one of the keys to a successful foundation trust. We therefore would like to attract as many members as possible. Anyone over 16 years of age can become a member, and we want to recruit members from all parts of the community, from all ages and from all ethnic backgrounds, so that our membership reflects the rich diversity of the area we cover. The more people who become members, the closer we think we will get to the communities we serve. Above all, we're looking for people who want to contribute, by pledging support, by getting involved, by, for example, volunteering or sharing experiences and views, to improve mental health well-being throughout the area. Why become a member? We think there are many good reasons for you to become a member. You can make a difference. Your voice will be heard, your views will count, and you can represent the community in which you live. As a member, you will be consulted on service changes and improvements, and so we can draw upon your experience. By becoming a member, you will also learn far more about mental health. The Trust will keep you up to date with developments, will provide you with the latest information on mental health issues, and enable you to use this knowledge to give the Trust the benefit of your views. Above all, by becoming a member, you will be demonstrating your support for mental health and for the people who provide our services. If you have time, and you want to be more involved than just being a member, we'll also be setting up several advisory groups that you can join, and through your participation in them, help us to improve the services in particular areas. You can even be more involved by standing for election as a governor, representing the views of the different groups who elect governors, service users or carers, or staff, or members of the public. You can even apply to become a non-executive director in the Trust if you think that you have something special to offer. As I mentioned earlier, you can give as much or as little time as you want to the role. It's purely up to you, and there is no payment involved. There's no obligation on you to do anything specific, but by becoming a member you will, at the very least, be giving out a positive signal that you care about mental health issues, and in doing so you will be helping to combat the stigma surrounding mental health illness. Another benefit of becoming a member is that you can stand for election as a governor, and I'll expand on this shortly. Now this is a really important issue, as we want to be sure that we have enough governors to represent our members and our partner organisations effectively, without having so many that the governing structure becomes unwieldy. Governors represent the people who voted to elect them, from categories such as staff, the public, service users or carers. And governors will fulfil an important link between the board of directors and members. The number of governors who represent service users, carers, staff and members of the public will always be greater than the number of governors nominated to represent our other partners, such as primary care trusts, local authorities, universities or voluntary organisations. And whilst there is no payment for governors, they will be able to volunteer their expertise to get involved in different aspects of the Trust and to help make a difference. The role of governor is very important, and the key responsibilities of governors are as follows. Governors appoint the chair and the non-executive directors, and they approve the appointment of the Trust's chief executive. They approve the appointment of the Trust's auditors, and they receive and are consulted on plans submitted by the board of directors. They also receive the Trust's annual report, the annual accounts and the annual plan. And finally, they review the Trust's membership strategy, which they do annually, and they contribute to its ongoing development. There are 10 specific questions in relation to which we would like to receive your views and which are being discussed at each of the consultation meetings. The issues include ideas for engaging with young people, your views on dedicated membership groups or constituencies for service users and carers, your views on our plans for those constituencies, and the size of the Board of Governors. your views on how governors may work together, and how we can assess the performance of the Board of Governors. We also want your views on how we might encourage members to vote in elections, and how we might encourage members to stand for election as governors themselves. We want to know what you think about encouraging governors to speak out for mental health, and any other comments and proposals that you may have about us becoming an NHS Foundation Trust. So to sum up, as a Foundation Trust, our communities will have a stronger voice through our membership. We'll have greater flexibility to shape services to meet local needs, and those services will be delivered cost effectively. We'll have financial flexibility for the future, and our partners will be represented on our Board of Governors. You will also have the reassurance that we're delivering services of quality. Thank you again for taking the time to listen to me. If I can just remind you that consultation runs from the 1st of September to the 26th of November 2009. If you get the chance, please complete one of our formal consultation feedback forms. And if you want to know more, you can do a number of things. You can visit our website at www.awp.nhs.uk, or you can telephone us with your views on either of the following numbers: on 0800 694 990, that's 0800 694 990, or 01249 468 377, that's 01249 468 377. Or you can email us at the following address: foundationtrustinfo@awp.nhs.uk. That's foundationtrustinfo, all one word, at awp.nhs.uk. Or if you wish, you can come along in person to one of our public meetings, and they're being run across the area, to give us your thoughts in person. So, please join us in helping to enable and empower people to reach their potential and to live fulfilling lives. Thank you.